It's so interesting because I think one of the challenges for medical health practitioners in general, given the so much information out there, is what defines the difference in you as a practitioner. I
Yeah.
mean, why would people bother to come to see you?
Yeah.
And I think that's a fundamental question I think a lot more health practitioners should be asking themselves.
Yeah, I think it's a really powerful one to ask, even just as a person, not as a health practitioner.
Absolutely. Yeah, yeah, absolutely.
What defines you as a person? What defines the things that are the boundaries of what you would love to talk about and what you're here to talk about, and what wisdom can you share from your experience as well as your qualification? I think there's scope of practice questions in there as well, as to what are the pieces that you're actually qualified to talk about, and in the context of your wisdom and your experience, and how would you like to portray that? Many of us, with the modernity of being able to be a practitioner, how do we balance that with social media? How do we balance that with appearing on places like YouTube and podcasts? How do we balance sharing our wisdom in a way that's going to be beneficial, rather than going to just be more noise in this world that we live in? Yeah.
Yeah, it's a lot more challenging though for health practitioners than it was. I mean, Tammy, I've been a health practitioner for a lot longer than you have, I think. And I know that when I kicked off my practice in the late 70s, right, there was no Google, there was no, if you really had to go looking for information. And so the doctor, as a godlike figure of knowledge, was indisputable. But
Yeah.
now our patients are coming in really well educated. And I know a lot of doctors and practitioners, particularly doctors, will dismiss this as Dr. Google. But gee, I tell you what, a lot of patients are very able, very capable of reading and understanding with less sort of baggage,
Mm.
and so it becomes
Yeah.
very challenging to approach this. How do you navigate that? How do you advise your clients? Because I know you are mentoring a lot of health practitioners as well. How do
Yeah.
you advise that? How do you?
Yeah. So in our world, in the world of especially natural health practitioners and allied health, we do have a tendency to have a little bit more time with our clients. And in understanding that we have more time, there is an opportunity to build relationship and rapport in a way that isn't transactional, that might happen in a short period of time, where somebody's trying to be discerning about the research that their client's done and brought with them. We do have an opportunity to have more of a transformational conversation than a transactional one. And that transformation happens through relationship building and empowering and collaborating with the client or the patient to come to a place of understanding, rather than that one way delivery of what's actually happening, what the opportunities or the options are for treatment, and what you're actually going to get from a behavioural change perspective with that person in front of you. So I think the empowering a client to be able to know themselves and know their own body is an amazing gift that we have as practitioners. And in working with them to do that, we do need a little dash more time to build that rapport and relationship. But I think it's much more rewarding in the long run. And even, one of the things that we do with our practitioners is empowering people to understand their own pathology results. And I know this is going to be a dubious kind of thing for a lot of practitioners, but empowering a human to understand the cells inside their body. My background's in cancer research and pathology, and I genuinely believe if you've got some signals and signs that happen to be on a paper that happens to be your pathology results, and you can read those signals and signs as a snapshot of your health, of what's going on the inside of this 3 trillion cell bag of cells that you get to wander around in all the time, what an empowering thing for a human to be able to do, to understand what's happening under the surface of what's going on for them. And in doing so, people are more empowered to start to make choices that are going to be beneficial for what's happening under that skin and in those bag of cells. And in doing so, I think there's a ripple effect in being able to influence the people around them. And so it's not that burden that the doctor is the only source of that information, that a human is empowered to get their own information about their health is profound, I think.
It's interesting you've used the word transactional and transformational, and I know you've kind of described it a little bit, but our listener may have missed it a little bit. And I think it's worth backtracking a little bit to just define the difference between transformational interaction with a health practitioner and transactional interaction.
Yeah, so we're living in a time where we can transact all sorts of things. Transactional is paying for whatever it happens to be with time, energy, or money. You're paying for that thing. And then as a result, you get whatever you paid for. And a transaction is, I expect to get, I don't want to use too many knots. I expect to get, a particular medicine, and I don't really want to have to talk to anybody about it. I just want the medicine. Let's say a paracetamol. I get the paracetamol, it comes back. In a very short period of time, if you only can describe one particular symptomology that you have, and many of us have experienced this through telehealth, we fill in the form and it says, what's the one thing you want to talk to your doctor about today? And you're like, well, there's a lot of stuff going on, but here's the one thing. And when you go in, you get that one thing dealt with, you pay your money, and that's that. There isn't a lot of scope for something other than a transaction. And that transaction is tit for tat. Whereas a transformation is, how can I shift internally from the path I was on to a different path through, and Edison and Hippocrates had something to say about this, through a conversation, through empowering knowledge, through imparting wisdom. How can I shift from the track I was going on, whether that's down to gangrene or some other end point of type 2 diabetes assessment, versus I'm now empowered to make these changes to my diet, to my lifestyle, to the stresses in my life, and even to, what job I am now going to do, what I'm saying yes and saying no to, because I had a transformational conversation. I had a transformational interaction and relationship that has changed the trajectory of where I'm headed with my health and my well-being.
Yes, I love that. And I think it was worth just reminding our listener about the difference. And of course, if one had to say, how is medicine practiced? I think a $1.6 trillion pharmaceutical industry would go a long way to describing how transactional medicine is conducted.
Agreed.
And it's a great economic model. There's no question about that.
Yes.
It's a win-win. It's a win for the pharmaceutical industry. It's actually not a win for public health, not a win for individual health.
Or preventative medicine.
Or preventive medicine, or the health of the practitioner.
Absolutely.
I would observe, which is something that we were going to talk about. And it's something that we've explored on the podcast before with doctors and nurses, but I haven't really done it with allied health, natural health practitioners. Just remind our listener who that encompasses.